8,000 years ago, someone held a patient still. A stone blade touched the living skull. Then the cutting began. There was no electric light, no stainless steel, no modern anesthesia, only stone, bone, hands, and nerve. The goal was terrifyingly simple: open a hole in the head, and somehow keep the patient alive. This operation is called trepanation. It may be humanity's oldest documented surgery. Archaeologists found it worldwide: Europe, Africa, Asia, and the Americas. Different cultures reached the same idea. Cutting the skull could sometimes save a life. Many date to the Neolithic period. People attempted brain surgery before writing, before cities, before metal tools. Yet the skulls reveal something astonishing. Many patients survived. Bone changes after injury. Fresh edges become rounded and porous. New bone forms around it. That healing takes months or years. So healed edges carry a quiet message. The patient lived after the hole was made. How did prehistoric surgeons avoid catastrophe? First, they rarely cut into the brain. The skull protects delicate layers. These membranes are called the meninges. The toughest outer layer is the dura mater. Piercing it increased bleeding and infection. Skilled operators stopped before reaching it. They removed bone, not brain tissue. Several methods were used. Some slowly scraped the skull with stone. Others cut grooves around a square. Some drilled holes in a circle. Then they lifted the bone piece. Scraping was slow, but controllable. Each stroke removed a thin layer. That reduced sudden penetration. But sharp tools could not stop pain. Alcohol may have helped. Plants may have dulled pain. Direct evidence remains limited. Imagine stone grinding against your skull. The skull has few pain-sensitive nerves. The scalp has many. Bleeding began before reaching bone. Assistance may have restrained the patient. Ritual may have transformed terror into endurance. Why would anyone accept such suffering? The clearest reason was severe head trauma. Clubs, stones, falls, and weapons shattered skulls. Broken bone could press inward. Blood could collect beneath the skull. Pressure could crush the brain from inside. An opening might relieve pressure. It could remove broken bone. It could clean damaged edges. It could give swelling room. Modern surgeons still drill for pressure. The instruments changed. The emergency did not. Not every operation followed injury. Some skulls have holes without fractures. That uncertainty created darker explanations. Paul Broca studied a Peruvian skull in 1867. Ephraim Squire brought it to Paris. The skull had a deliberate rectangular opening. Broca saw healing along its edges. The person had survived. Broca suggested some treated convulsions. He also considered spiritual causes. Perhaps a hole released a supernatural force. Perhaps removed bone became an amulet. But archaeology cannot recover intention. A hole cannot reveal the belief behind it. So what separates medicine from ritual? Location matters. Openings near fractures suggest practical treatment. Repeated patterns suggest specialists. Survival rates reveal better technique. Ancient Peru provides the clearest evidence. They scraped, cut, grooved, and drilled. Some patients received several operations. One skull can carry several healed openings. That person returned to the surgeon. In 2008, researchers studied Cusco remains. They examined 66 people with 109 openings. Estimated survival reached 83%. Little infection appeared in healed bone. That was not luck, repeated 109 times. It was accumulated knowledge. Later researchers tracked outcomes. Early Peruvian survival neared 40%. Between 1000 and 1400, it reached 91%. Techniques became smaller, cleaner, and precise. Bad methods disappeared. Successful methods spread. Generations learned from life and death. Could prehistoric surgery outperform modern medicine? During the American Civil War, cranial surgery stayed deadly. Infection followed dirty hands, tools, and hospitals. Antiseptic practice was not yet routine. Mortality approached 50%. Some ancient Peruvians did far better. They lacked germ theory. Cleaner environments may have helped. Most importantly, they learned where not to cut. Their expertise was written in scars. Hippocrates later described trepanning in Greece. He warned that rotating drills created dangerous heat. He advised cooling instruments with water. That instruction sounds remarkably modern. Heat damages living bone. Ancient surgeons learned through observation. Every improvement probably caused pain. Every rule may have begun with death. Trepanation was never one tradition. It appeared independently across distant societies. Some operations treated trauma. Some may have served ritual purposes. Others remain impossible to classify. Women, men, and children underwent it. Some survived until complete healing. Some died during or after cutting. The skull preserves both outcomes. That is why trepanation feels unsettling. It destroys our favorite story of progress. We imagine surgery began in hospitals, but necessity creates knowledge without modern science. A healer did not need the term intracranial pressure. They only needed to notice survivors. They watched. They remembered. They changed the next operation. Thousands of years later, surgeons still open skulls. The room is cleaner. The tools are finer. The fear is probably the same. Trepanation was not proof of recklessness. It proved ancient healers watched death closely. The whole was not primitive medicine. It was medicine becoming visible.